very much to the Workers' Party for the invitation. No strangers in this room. I have a strong family background, obviously, with members of the party, and very proud history in the party from members of my late mother and father, Francis and Bretton, who are on my mind today. Particularly my mother's on my mind today. My dad's not so much on my mind today, because I'll be tortured from him. But as I say, it's good to see so many faces. I was about to say older, but you know what I mean, faces from the past, and also family members who don't get together that often, but it's good to catch up with everybody. So first of all, thanks very much for the invitation, and suppose it just by way of just sort of leading up to the strike and as much information as we can about the issues around health. We'll go on, obviously, the next speakers. There's two excellent trade unionists as well here who I have a big respect for Carmel and Kevin from Unite and NIPSA, who will be speaking next, and you get a lot more information from them as well. But in regards to leading up this strike, it's been touched on by Lily very adequately this morning in regards to the other issues. It's not just about pay, and it isn't just about pay, it's about how we got to this situation. So one of the big issues is the minute within the health service is about outsourcing, and outsourcing is the road to privatisation, if not privatisation by another name. So as many as you will know, there's actually huge amounts of jobs in the health service that are being unfilled. There's hundreds of jobs going in the health service that people can't get into because it's made extremely bureaucratic, and it's also outsourced the recruitment. All our 6 trusts in the region don't have the ability to actually recruit their own staff, believe it or not. That's all outsourced to shared services model. Now, it's not the shared services model of the people or the workers who work in those areas that why there's a big sort of bottleneck within recruitment. They too are completely underfunded. Them too are not being supported in regards to way of training, development, and also financial resources to do the recruitment properly. That's not by accident, that's by design. That is by a decision to deliberately fragment, break up, and then eventually privatise, and that's the agenda. We have absolutely no doubt about that. So in order to actually fill all those posts, we need to actually recruit and modernise the workforce and bring that back in-house as quickly as possible, or properly fund the arm's length structures that are there to do that, to boost recruitment and enhance the workforce. Lily touched on this morning primary care. Primary care is a perfect example of the damage of privatisation. I'm almost as scared to go to my own GP because of arguments of that with GP federations and all the rest of it in regards to our views on the GP situation. GPs are actually much more akin to the Federation of Small Businesses as they are to the NHS. They have, in regards to, as the book Lily touched on earlier, encouraged everybody to read it, In Place of Fear, from Nay Bevan. He stated in that book that he had to shove their mouths full of gold to actually get them to sign up to the NHS, and that hasn't changed from 1948. They should be salaried, they should be taken in-house, and notice the next, well, as much as I hate to say the small L, the Labour Party in England and under Starmer has said that the direction of travel they would be bringing would be to bring back in a salaried approach to the GP services and bring them in-house. I think that's the best way to go. The GP Federation, more than anything, value their independence and their ability to have their own hours and its own structures. GPs actually don't even have contracts by way of contracted hours or to provide a certain service. So that needs radical reform, and it can only be radical reform if you actually own it. There's a key thing here running through, you'll see on television from all the academics, and believe it or not, John Campbell doesn't have all the answers. And you know, and so the bottom line is that you cannot reform what you don't own. So he constantly says about reforming, and the system where Bengoa or anybody else constantly talks about reform, but they never say in any of their documentations or any of their research that you can only reform it if you own it. And if you don't own it, you can't reform it. If it belongs to somebody else, it doesn't belong to you. So you can't really, you're only commenting on it. So first of all, take back public ownership of health service, take back public ownership of our health service in its totality, both in primary care and in acute care. So, and also obviously within the statutory sector and nursing homes and so forth. In the community, domiciliary care, in Belfast alone, this is reflected right across the region. In Belfast, it's almost 87% privatised. there's only a very small amount of people. So our calculations predict, given the demographics of the age workforce and the flow of recruitment into the public element of the domiciliary care, it's probably within the next 3 to 5 years that will be 100% privatised in domiciliary care. That's home care workers, and they are made up of multiple different employers. The way to deal with that is twofold in my view. One, there should be an agreement at the commissioning stage that in regards to commissioning services to those entities, they should have terms and conditions attached to them, that they should have recognition agreements built in to publicly for recognising trade union rights, first and foremost for the workers who work in that sector, and also from a commissioning point of view, they should have the right to collective bargaining for pay and so forth. But fundamentally, they should be brought back in-house. They should be brought back in-house to provide that statutory duty of providing care in the community under the NHS model, and not one for profit, because that's what's happening at the minute. Domiciliary care workers are paid by the client, not by the hour. The vast majority of them are on zero-hour contracts, and they have little or no trade union rights. So these are the things that are undermining the health service in regards to a way of primary care that urgently need our attention to if we're going to improve the situations in hospitals. Many of you have seen over the last number of months, particularly the winter months, huge backlogs in all the EDs. BBC like to come in the news, need to come in and film there's like a disaster stolen in RDs, and that's indicative of what's happening in the community. There's nobody being discharged. There's a reason why there's nobody being discharged is because the care in the community, as I say, is largely privatised, and because it's largely privatised, we can't get people proper care packages, and therefore the patient flow of the hospital is not being seen to be what it's meant to do on the tin, have that flow through the hospital, so it's being all log jammed in ED. So therefore the problem lies with it's the manifestation of privatisation in the community is why you see that in all our hospitals. There's actually less people coming through our hospital ED departments. They're just sicker. That's a reflection of the whole issues around COVID and not being able to see doctors, and those underlying health problems are all being caught up now. But however, still huge amounts of outsourcing within the hospitals, whether it be MRIs, whether it be CTs, whether it be diagnostic testing in general. A lot of that's being outsourced. There's the issue around Encompass who are coming in to look at the whole admin and clerical workforce within the NHS, overseen by systems called EPIC. EPIC is the computerized system that's going to be the new system to look at the patient records, the patient flow scenario. So they're trying to call this what they are calling the patient passport. But really, realistically, it's preparation for privatisation. EPIC is the system in the States that invoices you when you leave hospital. So when you go to the hospital in the States and you go through all the tests and procedures that you go through, at the end of that you're given an invoice. EPIC is the system that generates that invoice, and that's being installed here now. They say that's not what it's for, it's just for the patient passport. I don't believe that for 1 second. That's all the infrastructure being placed to allow for the final solution to that too, and the privatisation, and the workers are obviously impacted in that from an admin and clerical point of view. So the issues around NHS pay, big issue at the minute, right across the board, and it's been a big issue right from the beginning. We've got, and there's been a lot of debate around this in obviously all structures and all unions about NHS pay. Way back in the day, it was probably right that there was an independent pay review body established to address the inequalities that existed within grades in the NHS. So back in the day, it was collective bargaining for particular workforces, got particular pay enhancements. Pay review body was institutionalised, meant to be independent, and largely submit evidence to that to justify a pay uplift. But for every year it passes, it's become more and more, it's no more near independent. And its whole funding model is based on what financial envelope the government decides to give it, and it can only negotiate or offer in them boundaries. So the removal of the pay review body is essential, and the justification for that, there's a debate with that within the unions, obviously, and that's a healthy debate. But the justification for that is actually in this year's pay envelope. This is the first year, this is the biggest offer of pay, regardless of it's not enough to a degree, but it's still the biggest offer of pay in the NHS through direct negotiations with the government, as opposed to continuous 1% offers through the pay review body year after year. So the lesson in this, if there is a positive in this in regards to the offer, is pay raises will always be much better with direct negotiations with the government. in regards to outcomes off the back of that leverage of industrial action. It is the only language they understand, it's the only language they will ever understand. So the need to have industrial action along with direct negotiations is key. When we challenged at recent conferences Labour Party representatives on why they would not tear up the 2016 Act in England in regards to the trade union bill, that should be completely abolished and scrapped and allow unfettered access to workers' rights to take industrial action. The Labour Party in England haven't said that they would scrap that, which is a shame. But Stormont has been in place, say, from 1988, and every year it's had a chance to reform the laws around trade union rights. It has the chance to scrap trade union laws introduced by Thatcher. And as I say, there was some bills trying to be put through, but it's very important in the coming years through Congress particularly, and come together through the Irish Congress of Trade Unions, talk to stakeholders, lay representatives, trade union officials, people in this room to draft a proper document and a proper bill to go through here in regards to trade union rights and trade union reform, so that we can protect ourselves from the worst elements of Tory infringement when they want to do it out of whim. So it's important that that's also part of an overall Bill of Rights. So where we're at the minute is obviously huge industrial action right across the region, thousands of workers coming out and strike, and also every single day hundreds and hundreds of more workers being unionised across all unions, and that's a good thing, that's a positive thing. So if anything, that has allowed us to enhance our collective bargaining strength through that, but it's only good if we have collective bargaining mechanisms, and that's been decreasing year after year. So we don't know where we're going to go, obviously, by way of this year's offer. We have no assembly, and that's clear. However, the way we view it from a UNISON perspective is that the Stormont House Agreement assured pay parity. We believe that the Secretary of State here should make the offer to workers in Northern Ireland. That's what is the offer that's in place in England and Wales at the minute. Not to say that we are accepting it, but to allow our members the opportunity to vote on it is key. It's our members who will decide whether that's a good deal or a bad deal, but we will not be denied our democratic right to actually look at a pay offer and then determine whether they're going to accept that or not. I think workers all deserve that, and workers deserve that chance to look at that, particularly through the amount of industrial action people have been participating in, the financial impact on them and their families, but also the emotional impact of actually getting through all that in regards to having to take on industrial action. Our hospitals are in an awful state as well in regards to investment in infrastructure, in regards to the conditions of workers where they are, whether it be change of facilities. People tend to forget about these things that are so important. There's a reason why a hospital doesn't smell like a hospital no more. There's a reason why when you go into hospitals they look like dumping grounds for roll cages, mattresses and so forth. There isn't that investment or attention to detail paid anymore in regards to keeping a hospital, enhancing its biodiversity in a hospital, and making sure that a hospital is not only a good environment to work in, but a good environment for patients to come to. So as I say, more and more issues around that are coming to the fore that need to be addressed. We've got, thankfully, the removal of, through heavy lobbying, the removal of car park charges across the region. Hopefully they'll be introduced soon by way of the removal of them. They're largely positive, but at the same time, there's so many issues to be addressed in the health service that we need to collectively come together. And as I say, it's important that communities, more importantly, come together as well to actually speak up more about the health service, and also do away with these terrible artificial public consultations on reconfiguration of services, as if somehow you fill in something online and some way that influences an outcome. It'll only influence an outcome through collective organisation and mobilisation of people coming together. Huge crowds, obviously, have seen it in the SWA and in the Mid-Ulster region as well, caring about their health service and wanting to make sure that they have a voice and a say in any so-called reconfiguration or reform in that. So, and that's key here, as Lily touched on earlier with the Transforming Your Care. That was a fundamental reason why Transforming Your Care didn't get to do what it was meant to do quicker, because of the mobilisation of opposition that's opposing what it was trying to introduce: more privatisation, more fragmentation and more casualisation. And that's the issue around with the workforce and what I touched on at the beginning with the recruitment. There's mass casualisation right across our health service. Far too many, as you'll have seen, the agency spend in nursing and band 5 and 6 alone. The agency spend for Belfast Trust alone, coming up to the end of probably April this financial year, will be close to £100 million, and that's a disaster, because what we're trying to negotiate here, and what we're saying is not only at that defend the problem, and this is the thing, you'll see through the strikes, many journalists talking to workers and asking them, you know, do they find it hard by way of the financial situation that they're in? But they never say to the worker, you've just told me you're here 35 years, have you any ideas about how to improve the services you work in, or where you come from? There's no desire to talk that, or no space for workers to be part of the debate. There's no space for workers to be part and be included in the reform of the health service, and that needs to be part of this reform. So when workers say in this issue around the nursing spend and the agency spend, off-contract agencies are ending at the end of this month in nursing. So if something ends, something needs to begin, and that's why we were saying it needs radical reform of the public ownership of a nurse bank, regional bank, owned by the NHS and run by the NHS, so nurses can get a better enhancement working in through the nurse bank, and providing that continuity of care in their own wards with their own patients, instead of having to leave hospitals to go to Antrim or everywhere else, because you're not allowed to do agency in your own hospital, to do a shift. If you go into our wards, you'll see nurses in all different uniforms. You wouldn't have seen that years ago. Now the nurses are going second and third down the pecking order by way of staffing establishment, and that mass casualisation is in all of our wards, and that's partly due with the outsourcing of recruitment. It's really, really difficult to actually get health workers, as I said. So managers have now said, instead of that whole laborious process of trying to get a worker in here, what I'll do is I'll just lift the agency and black book the agency. So you have agency workers now working who have 4 or 5 years more service, but will count for nothing by way of trying to be social mobility or actually trying to get a permanent contract. So that casualisation is also deliberate, because if you're casualising the workforce, you're also undermining collective bargaining, you're also undermining trade union rights and everything else that comes along with it. So it's really important that all of those moving parts are brought together, but they can only be brought together by mobilising conferences like this, mobilising discussions like this, debates like this within the community, and letting the community be part of the change and driving that change and having a say in it, instead of saying, book your slot on a public consultation, write us an email and we'll take it into consideration, but they don't listen. So it's important that going forward, we'll need to be making sure it's our health service. Bevan left us all in charge of keeping, as he said, it'll last as long as people have the faith to fight for it. And we do have the faith to fight for it, but we're constantly put up in barriers and where we can say our piece and how we can say it and who we can say it to. And we shouldn't take no notice of that. Certainly from our discussions with the Department of Health and anybody else, it needs to be radical, and it needs to be reformed. It needs to be less bureaucratic. It needs to be telling them exactly what we want based on the principles of the NHS. And if we don't get that, then we obviously mobilise and collectively bargain and potentially take industrial action where necessary. But at the same time, we can't let them do what they're doing at the minute, and that is just break up, privatise and casualise, and that's the problem. That's going to be too late soon. So community care, big massive issue, as I said. It's not too late to save community care, but what we need, and I've said this before, whoever's the next health minister, every single health minister this country's had by way of from 1998 has not upheld the principles of the NHS, has not addressed some of the underlying issues in regards to what needs addressed urgently. I'll give credit where credit's due. Actually, McCarthy at the time, he did reintroduce free prescription charges, and as saying that's something people take, okay, that's a norm. But if you go to England and you go to casualties in England, you'll see bank machines in the A&Es, and that's where you can put in your slip and pay for your credit card for your discharge tablets. So people, you don't visually see that, but when you do visually see that, you see that in many respects we're a bit more lucky here and we're a bit more better off by way of, and that's only been through our protection of the NHS here. Or I think actually England can learn an awful lot from us and how we protect our public services, as I always like to say when I'm over there, at least we still own our trains and buses, sort of thing. So so the bottom line is, I suppose, just to conclude, that we hope this strike brings about a pay agreement voted on by our members, but we hope it leads to something more positive by way of enhanced collective bargaining rights for workers, and also a better pay deal going on in the absence of a pay review body and those direct negotiations with the powers that be to deliver a better pay deal. Mark my words, you've seen the Scottish situation, not by any stretch of imagination. I heard comments earlier on from John about the SNP. They're far from progressive and left thinking in regards to their attitude, but the bottom line is that through direct negotiations with the devolved institutions brought about better enhancements in pay and so forth. We need that here. We have devolved institutions, we have devolved mechanisms here that we need to be engaging with, and they need to be accountable. We will not listen to any politician here who says it's Westminster's fault. You have a budget, you have a significant amount of money, it's how you choose to spend it, and if you choose to listen to the private lobby about how you spend it by outsourcing waiting lists and outsourcing everything else, then we're going to blame you. But if you actually listen to the workers who are central to this, the reform, and take workers and trade unions and board and part of proper structures about changing how we fund our health service, you will not only save money, but patients will have a better outcome. So thanks very much. Thank you.
Thanks, Conor, for the industrial action that has been waged by the healthcare workers across the various unions in the last number of months. And whatever steps you take, you can be assured we'll stand behind you. But thank you again. If there are any questions or comments?
That no longer exists, and we did the same in Newry and Mourne, in Banbridge and Craigavon Trust, and Transforming Your Care and other snappy bits as people left. They actually dismantled all of that. So you're absolutely right, and I think only industrial action and the voice of people will stop that.